Welcome back to the Lymphoma and Related Diseases Registry. Today I'm very honored to have Dr. Allison Barraclough next to me. Hi, Allison.
Hi, Eliza. How are you?
I'm good, thanks. Can you tell us about yourself?
So I am a haematologist at Fiona Stanley Hospital in Perth. I'm also the CAR-T director, so I've got a very special interest in lymphoma. I'm also very interested in research. I'm the co-chief investigator of the NHL33 clinical trial run through the ALLG. That's an upfront mantle cell lymphoma trial, and I'm PI in a number of trials at Fiona Stanley Hospital, especially the ones involving lymphoma. And as you know, I am a member of the data validation group for the Lymphoma Registry as well.
Yeah, that sounds very good. What does this data validation working group do?
Basically, we bring together PIs from the registry and also study coordinators, and I co-chair a meeting at least annually. And it's a really good forum because we can give the people that dial in updates about the registry, and we also talk through problems associated with the registry. As you know, it can be challenging to put in data, and we want that data to be as accurate as possible. So we use this forum to answer questions and provide advice to try and make that data accurate.
Yeah, I see that is a good opportunity for people to enter data and that researchers can use this data for research. In saying that, I know you have recently published the GELF study.
Yes.
Can you tell us about this study as well?
This study was one of the first studies that came out of the Lymphoma Registry. It's a number of clinical and disease characteristics that show that patients have increased tumour burden. So things like increased LDH, bulky disease, symptoms. Basically what we did was we used this study to see if clinicians were actually using GELF criteria in real life, because GELF criteria is often used for clinical trial eligibility. And what we found that a large proportion of patients who have no GELF criteria are being treated, and many patients with GELF criteria are not being treated. And actually, GELF criteria did not have any prognostic relevance as well. So what we did is we used a lot of data points from the registry, but the registry was very new. So then we went to sites to get additional information and also extended follow-up as well. So it's really nice. You can use the data from the registry, but you can also go to sites to get additional data points that you need. So we used a combination of that to bring it together.
Yeah, so registry was the place where you identify eligible patients.
Yes.
And then give you a platform to connect with other collaborators.
Exactly.
What are the potential or opportunities you see in our registry as an early career researcher?
Doing these retrospective studies as an early career researcher is the best way to get into research. It's very collaborative, so you're building your research network with other people around Australia. The data and the case finding is all done for you through the registry, so it's a really simple way. And if you're interested in doing statistical analysis yourself, this is also a good way to get involved in that. So before you go into prospective clinical trials or investigator-initiated trials, this is a really good resource to use, especially in rare diseases. You're not going to do prospective trials in rare diseases. It's really hard to recruit to them. So gathering this information, especially for rare diseases, is really crucial and critical.
All right, that's a lot of insight. Thank you so much, Allison.
My pleasure. Thanks, Eliza.
Thank you. We'll see you next time. Bye-bye.
Bye.